This is Boomer Life on CL 650.
There you go. You request it. Dwayne gets it.
Found the song.
There you go. Rock and Roll All Night by Kiss. And we're talking about tongues. And Gene Simmons is notorious for his long tongue that he used to great expertise by making himself a worldwide star. And who knows what else. And we also talk about, rock and roll all night and party every day. Well, if you have a good night's sleep, you can party all day.
Yeah.
And you have a slogan at your clinic called Sleep Better, Live Better, which is pretty basic. If you're getting a better night's sleep, you're going to have a better day.
Yes.
And you see that correlation. People that don't sleep well don't do well during the day.
That's right. They're falling asleep during the day. They're grumpy. They're tired. They're, irritable. All sorts of things happen when you don't sleep well at night. Most people will have experienced it for the first time after a newborn.
Yes. And when people come to you and we're going to talk about the appliances specifically, but I'll kind of skip forward. When they are fitted with the device and then they come back to you for a follow-up, what kind of reaction do you get? Now, not the sleeping, the alertness, the awareness.
Yeah.
So what do they say?
And the pleasantness. Mm-hmm. They're pleasant. I had a gentleman in yesterday, and it was his 1 month follow-up. He got his appliance just before Christmas. And he walked in and he said, I have not slept this well in years. Mm-hmm. I actually wake up. I feel alert. I'm ready for the day. I can take on anything. I feel like I can play with the grandchildren now. I'm not worried about driving anymore and being so tired. I'm not so snappy. It just changes their life when they can start sleeping with quality.
And I'm sure the other comment is, I should have come in sooner.
Yes. Yeah, we do hear that a lot. Why didn't I do this sooner? Some patients just didn't know. Some people were undiagnosed for a long period of time, not knowing why they were tired or grumpy, or they just thought what they were was normal.
Now, what is the average age of a client of yours? I
would say the average age is probably about 45 to 55 years old.
Really?
That's when I first see a fair number of patients. Now, I have treated patients certainly in their late teens and early 20s, and I've also treated patients well into their 70s. Mm-hmm. But I would say the vast majority of patients, if they have disruptive sleeping or they have prolonged unexplained fatigue during the day, we're seeing them somewhere in and around the age of 50 where they're just done with it. Mm-hmm. They need help with it, or their bed partner or spouse at home is not going to put up with it anymore.
So you're saying that it's about 50-50 for the snoring and for the tiredness.
Yeah.
And so that's called sleep apnea, right?
Right. So now snoring can cause tiredness as well.
Right.
But vast majority of patients that have a fatigue component have some degree of airway restriction, either mild apnea all the way up to severe apnea. It amazes me that a lot of my severe apneics actually aren't tired, but that's usually explained because they have more events in their airway closing, but they're shorter events. So say their events are only 15 seconds long. It's still enough to be a health risk, but it might not cause the oxygen or drops or the fatigue. Whereas some patients, even very mild, say they stop breathing 8 to 10 times an hour in the mild category, but they're very fatigued. It affects them a lot.
So they're not getting air for a longer period of time. So that part of your brain that keeps you alive wakes you up.
Yeah.
And get you to move, I'm guessing.
Right. So it can do a number of things, but your brain alertness it'll lift you out of deep sleep. It'll go on guard. It'll go into fight and flight. It'll make you think the enemy is trying to strangle you. Mm-hmm. It'll increase your heart rate and your blood pressure. It'll lift you out of deep sleep. It sometimes will wake you up and you'll think, I have to go to the bathroom. Well, you don't. It was just your body trying to wake you up to breathe. Yeah.
Dr. Sharnell Muir is the Snore Dentist, and the website is snoredentist.ca. Now we're going to get into the actual, what do you call them, appliances, devices?
They actually have a medical name. They're called either mandibular repositioning devices or mandibular advancing devices.
And explain why it's called an advancing device. So explain what it does.
Right. So all of the oral appliances that are used for snoring and sleep apnea are custom made, and they hold the lower jaw slightly forward and prevent it from falling back. When I hold the lower jaw forward, I hold the base of the tongue forward because it's attached to the lower jaw. So my job is to make the airway slightly larger at start and then prevent it from collapsing back.
Now, how much movement are we talking about here?
A few millimeters.
That's it.
Yeah. So most jaws will have a forward and back range of motion.
So I guess right now you can get your people listening to push their lower jaw
forward and back.
So you put your lower teeth in front of your front teeth.
That's right. Do the bulldog bite, right?
Yeah.
So if you do that range of motion on average is 10 millimeters. I see 5 to 15 in most patients, and 10 is the average. But we only start patients halfway along that range of motion. So for the average patient, we're only moving their lower jaw forward 4 to 5 millimeters.
So I think you mentioned one time before that imagine your upper and lower teeth
edge
together.
to edge.
Edge to edge, yeah.
Yeah. So if you bite edge to edge as if you were biting into an apple or a sandwich or that lettuce, you're trying to bite that lettuce edge to edge, then that's a common space for a lot of people to start at.
And that is something they can get used to pretty quickly?
Yeah, most people actually can adapt to wearing the appliance through the night in the first 1 to 3 nights.
Okay, can you show me the one on your right? Pass it to me. So this is, I'm just going to kind of describe it. So on the top and the bottom, there's what I would describe as kind of like a retainer-like device that covers all of your teeth, top and bottom.
Right.
So when you put these in, you put the bottom one in and then you put the top one in, and that's it? You don't put them in at the same time?
No, this one you can actually put separate parts in at individually, but we actually put the top in first and the bottom second. And the reason
knew I would get it wrong,
it's just that, if you put the bottom in first, that the mechanism there, that fin, can be in the way. But so for a lot of people out there that are listening, they may have worn or would know someone who wore something called a night guard for grinding.
Sure.
So this appliance is based on that type of appliance. It looks like 2 night guards that fit together. So there's a top and a bottom night guard. So they cover all of the teeth, just like the average night guard. And we cover all of the teeth for a couple of basic reasons. One is it means we're not putting pressure on any particular teeth, that it's just an anchor on to the holding the teeth, because they're my doorknob to keep the door open. But the other is we don't want the teeth to drift or move at night. We don't want spaces to happen if we can prevent it at all.
So you're spreading the load around the whole mouth, right?
And we're acting as a retainer as well, right? So, so this one, top and bottom fit together. When you close your jaws, the pieces kind of fit together like a jigsaw puzzle piece, and they hold that jaw forward. And then we can adjust that jaw position within that appliance.
So you don't have to get a new one.
You don't have to get a new one.
So you go, you visit your office and you get an imprint, I'm guessing, of your upper and lower bite.
Yeah.
And then then you get these devices made.
That's right. So we do a bite registration and an impression of top and bottom teeth. And that allows the manufacturer to custom make your medical device to fit just your mouth in how your jaw closes, because everyone's jaw closes differently.
And how do you track that range of motion that when you close your mouth? How do you do that? Right.
So there's a mechanism that we use that's a gauge that we put between your teeth, and we put material on it, and it fills the space to your teeth, whether they're farther apart or closer together.
Because you might chew on one side of your mouth,
right.
And that's maybe ground down a bit more?
That's right. So we want to register the bite in your mouth rather than, say, a generic bite, or sending models of your teeth to a laboratory and saying, okay, well, just open the space between the teeth and fill it up with something. That's not very accurate.
So you could have it narrower on one side and thicker on the other based on your bite.
Based on what that patient anatomy requires.
We don't have perfectly
We're
symmetrical.
not symmetrical. And if you put the mirror up and look at 2 of one side versus 2 of the other side, you live with 3 different people. So, yeah, they're
some
never
jokes
the same.
in there, yeah.
There's not a lot of perfect symmetry.
No.
In the structures of side to side.
How many people have gone and bought shoes over the years and one foot's slightly bigger or smaller than the other?
That's right. Or even your wrist size,
Yeah.
Are different. So everything is different side to side, and it's important to capture that.
So just like you wouldn't expect to, other than reading glasses, if you're going to have glasses for distance, you can go to the eye doctor and get tested and get a prescription for your eyes. This is a prescription for your dental device,
That's right. So these are manufactured by prescription. They are a medical device, and they are made as such. So they are covered under the vast majority of extended health benefit plans as a prescription. Mm-hmm. We just send the prescription and the sleep study into your benefit plan to check whether or not it's covered or not. Mm-hmm. And some people will have that policy and some won't, but we work with those patients that don't. And then we can custom design the appliance. We can select the design of appliance that best fits that patient. We can take into any preferences that the patient has, whether or not they like metal, no metal, types of material, thinness, what they have for teeth, whether they're missing teeth, whether they wear dentures or partial dentures. So all of that needs to be taken into account.
All right.
Yeah.
We're speaking with the Snore Dentist, and the website is snoredentist.ca. Dr. Sharnell Muir is based in North Vancouver. You can go right online and make an appointment to see her there, or you can call and find out when Dr. Muir is visiting other clinics or other places around Greater Vancouver and the island. We'll continue our conversation next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.